Hi, I am Dr. Anantha Krishna. I am a practicing surgical gastroenterologist at Nano Hospitals, Uttarahalli. Endoscopy is a very commonly used diagnostic tool to see inside the patient's GIT, that is the gastrointestinal tract. So these endoscopies can be of broadly two types, that is an upper GI endoscopy, wherein we introduce the camera from the mouth of the patient. We see the upper GI tract that consists of the oral cavity, the food pipe and the stomach. The second type of endoscopy is the colonoscopy, wherein the camera is introduced through the anal canal of the patient and the entire large intestine and the last portion of the small intestine is seen. So who needs an endoscopy? So whenever the surgeon or the physician feels that there could be some disease inside the GI tract which needs to be seen, then an endoscopy will be required to be done. So during endoscopy, what should the patient expect? So during an upper GI endoscopy, there could be mild amount of discomfort. Initially, the endoscopist will give you an anesthetic spray to your throat and then the camera is introduced into the oral cavity. The endoscopist will ask you to swallow the scope and the scope will go inside. If some abnormality is found inside the GI tract, then a biopsy could be taken to take a sample of the problematic area and send it to the lab for testing. If there is no problem, the endoscopist will take a couple of photos and the camera is brought out. The entire procedure for the upper GI endoscope will take less than about 3 to 5 minutes and it is relatively comfortable after the endoscope is done. So coming to the colonoscopy, so in this colonoscopy the camera is introduced through the anal canal and as the camera advances the intestine is filled up with air. Due to this the patient will experience some amount of bloating sensation of the abdominal cavity and during the passage of the scope through the intestine at a couple of places there could be some pain. So generally the colonoscopy is done under sedation so that the discomfort is minimized. So even in this colonoscopy, if any abnormality is found, we might take a biopsy to send to the lab for testing. Or if there is no abnormality, photos will be taken and this camera is brought out of the intestine. So this is in brief about what is done and what should you expect during an endoscopy.